Hi friends, welcome back to my channel. Today we are going to discuss about another procedure, oxygen administration, and this video is mainly focusing on children. Okay, child oxygen administration in children is mainly focusing, and it is applicable for adults also. Okay. So what is oxygen therapy? Oxygen therapy means simply we are giving additional supplemental oxygen. Okay, for those who cannot take voluntary oxygen, that is simply oxygen therapy. Okay. So definition, oxygen therapy is a common supportive treatment for patients with acute respiratory failure and those with a chronic lung disease and hypoxemia. Hypoxemia means decreased oxygen level in blood. Okay. Hypoxia means decreased oxygen in tissue and hypoxemia means decreased oxygen level in blood. So it is a common supportive treatment for patients with acute respiratory failure and those with a chronic lung disease and hypoxia. Okay. So what are the indications of oxygen therapy? Okay. First one, hypoxemia. Okay, that is partial pressure of oxygen less than 60 millimeter of Hg. Then hypercapnia, increased carbon dioxide level. Then suspected hypoxemia, increased work of breathing, flaring, tachypnea, etc. are showing suspected hypoxemia. Then increased myocardial work, then upper airway obstructions, then drug overdose, then thoracic cage abnormalities such as fracture, then acute head injury. Okay, these are the indications of oxygen therapy and some indications of diseases such as pneumonia, asthma, BPD underdeveloped lungs in newborns, then heart failure, then spinal anesthesia, then trauma to respiratory system, etc. These are the other indications. Next, how to detect the need of oxygen. Okay, next is how we can assess the need of oxygen. First one is clinical evaluation. Okay, this is in this through some symptoms what a patient showing, we can assess the patient is dyspneic. Okay, next one is pulse oximeter. Pulse oximeter is a non-invasive method. It is asking many times. Okay, non-invasive method of assessing oxygen level of blood is pulse oximetry. Then ABG. Okay, these are the three needs, three detections. Clinical evaluation. What are the symptoms patient is showing? Okay, the first one restlessness, then headache, then confusion, then rapid heart rate, that is tachycardia, rapid breathing, that is tachypnea, and anxiety, then difficulty in breathing, that is dyspnea, then slow heart rate, bradycardia. In severe cases, okay, in severe, these are mild cases, then severe cases, slow heart rate, that is bradycardia, extreme restlessness will be there, and the cyanosis, that is bluish discoloration of the skin. Okay, that is cyanosis. These are the clinical evaluations. Okay, next second one is pulse oximetry. Okay, pulse oximetry. Normal pulse oximetry reading is 95 to 100%. Okay, this pulse oximetry is based on two lights, that is red light and infrared lights or IR light. Okay, see this picture. This finger is we are putting finger like this. Okay, finger like this, and we are passing IR light and red light through these fingers. And opposite side there is a photodetector is placed in the pulse oximeter. Okay. In case of oxygenated blood hemoglobin, that is no, if it is normal hemoglobin, it absorb more infrared light. Okay, infrared light is absorbing more and passing red light. Okay, passing only red light. Okay, that is normal. In case of deoxygenated hemoglobin, it absorbs more red light and infrared light is passing through it. That's why you are getting the reading like that. Okay, it is so simple. Okay. Okay, next method we can see about ABG. What is ABG? Arterial blood gas analysis. Okay, in this we are considering radial or brachial artery and taking 1 ml of blood with this capnized syringe. Okay, what are the normal values on ABG? First one pH, that is 7.35 to 7.45. Okay, when there is a below 7.35 it turns to acidosis and above 45 it turns to alkalosis. Okay, then partial pressure of carbon dioxide, that is 35 to 45 millimeter of Hg. Then partial pressure of oxygen 75, not 75, 85 is normal, 75 to 100 millimeter of Hg. Then bicarbonate 22 to 26, when it is exceeds 26 it will lead to alkalosis and it will decrease, it will lead to acidosis. Okay, and oxygen saturation greater than 95%. Okay, these are kpg values. Next one is treatment and methods. Okay, treatment and methods. And a treatment is based on first one age of the patient will be we are considering. Then what is the oxygen requirement or therapeutic goals of the patient? What condition, what type of condition is patient having? According to that, treatment will change. Okay, and patient tolerance to selected interference. What we are method, how the patient tolerate with the selected method, and humidification needs also we have to assess. Okay, next classification of oxygen delivery system. What are the oxygen delivery system? First one is low flow devices and second one is high flow devices. Okay, low flow and high flow devices. In low flow devices, we are giving low oxygen demand. Okay, we are meeting the oxygen demand just lower than the patient demand. Okay, and we are emphasizing the patient own respiration, that is low flow devices. Okay, it provides oxygen flow rates that lower than the patient's inspiratory demands. Okay, little lesser than the patient demand. Okay, we are giving little lesser oxygen than patient demand. When the total ventilation exceeds the capacity of oxygen reservoir, room air is entertained. Okay, that is low flow device. Next, in case of high flow device, the patient cannot breathe the voluntarily, so we have to deliver maximum concentration of oxygen where the patient need. In this fixed proportion of room air or fixed proportion of air flow rate, inspirator reserve flow rate we are maintaining. Okay, FiO2 we are considering. That is high flow devices. So what are the oxygen delivery devices in low flow system? Okay, low flow system. First one nasal cannula, then intranasal catheter, then simple mask, then partial rebreather mask, non-rebreathing mask. Okay, we can see the images. First one nasal cannula we all know. Then intranasal catheter, like this we are putting the catheter inside the nose. Then simple mask. Then partial rebreather mask. These are the low flow devices. Then high flow devices. What are the high flow devices? First one venturi system. Then oxygen hood, that is oxy hood. Phase tent, oxygen tent, high flow nasal prongs. Then CPAC, Celiox, hyperbaric oxygen, etc. Mainly using CPAP. So this is venturi mask, then oxygen hood, oxy hood, then oxygen tent. Tent means it's covering all over the bed of the baby. Okay, then oxygen tent, CPAP. This is CPAP. CPAP. Okay, oxygen hood is used for children and oxygen tent also used for pediatric cases. Okay. So CPAP, what is CPAP? Okay, CPAP. CPAP is continuous positive airway pressure. Okay, continuous positive airway pressure is CPAP. Okay, in this, when the partial pressure of oxygen is less than 60 millimeter of Hg, we are giving CPAP. Okay, it helps to maintain increased static compliance and reduce the work of breathing and improve ventilation perfusion ratio of the patient. Next, it is used in early ARDS. Okay, in case of severe ARDS, we go for mechanical ventilators. Okay, in early ARDS, we are using this. Then acute bronchitis, pneumonia, etc. We are using the CPAP. Okay, in case of patient with spontaneous breathing difficulty and require emergency intubation. Okay, before going to the emergency intubation, if the patient can be sometimes given to CPAP. Okay. And what are the potential complications of oxygen administration? First one, carbon dioxide narcosis. It's important. Increased carbon dioxide level in the body, that will cause carbon dioxide narcosis. Okay. Next one, or hypercapnia will be occur. Then pulmonary atherosclerosis, rupture of lungs will be occur. Then pulmonary oxygen toxicity will be occur. Then retrodental fibroplasia, it is important regarding pediatric case. Retrodental fibroplasia means when increasing the oxygen to the cerebral tissues of the baby, it will cause retrodental fibroplasia or retinopathy of prematurity. It is also known as retinopathy of prematurity. Okay, it is important. Okay, it causes visual impairment and blindness in the children. Next one, substernal pain. Okay, substernal pain due to characterized by difficulty in breathing, pain within the chest. Okay, occurring with the elevated pressure of oxygen. Okay, for extended periods. Okay, there will be a substernal pain when there is a continuous oxygen is providing. So these are the potential complications. Okay, next we can see what are the hazards of oxygen administration. First one, infection. When there is a continuous flow of oxygen, there will be chance of bacterial growth. Then combustion. Then drying of mucous membrane. Okay, to prevent this, we are giving humidification. But sometimes when there is a continuous overflow, there will be a chance of drying mucous membrane. Then oxygen toxicity will be there, then atherosclerosis will be there, oxygen induced apnea will be there, asphyxia will be there. Okay, these are the hazards of oxygen administration. So next we can move to the general instructions. What are general instructions before administering oxygen? Okay, before or doing while administering oxygen. First one, to avoid oxygen toxicity, we have to be careful. Okay, to avoid oxygen toxicity, prescribed in a prescribed manner and prescribed amount will be given by the nurse. Okay, next When using oxygen cylinder, there have a regulator and a humidifier. Okay, use a regulator and humidifier for oxygen cylinder. In case of central line, nowadays it is telling that no need of humidifier. Next, to prevent infection, clean the apparatus daily. Okay, daily or as whenever it is oiled. Okay, you have to be clean. And change catheter at least every 8 hours. Not 8 hours, now showing that 24 hours. Okay, 24 hours. For one day we have to change, when there is a continuous flow of oxygen, you have to change the catheter every 24 hours. Then lubricate the nasal catheter before administration. Then oxygen administration must never be stopped until the hypoxia is reversed. Okay, only hypoxia is reversed. The patient, once patient will be normal, the oxygen can be stopped. Okay, next, when there is a plan of discontinuation of oxygen, we have to discontinue gradually only. Okay, not a sudden discontinuation. When there is a, for example, if patient is going with a 60 liter of oxygen, we have to turn to 4 liter and 2 liter, then by only gradual stopping only possible. Okay, next one, when patient, whenever the patient is leaving by the nurse alone, we have to give adequate calling, instruct for calling signal. Okay, instruct for calling signal for the patient and instruct to bystanders. Okay, bystanders also for calling. Then watch for the patient for any oxygen, early oxygen toxicity, early signs of oxygen toxicity. We have to watch continuously. Okay. Next, what are the nurse's responsibility? First, check name, bed number and other identification of the patient. Then check the diagnosis of the patient and need of oxygen therapy, and check the doctor's order and the precautions regarding the positioning of the patient. Okay. Then assess any signs of client's anemia. Okay, anemia example cyanosis is there. We have to assess. Okay. Then mental state of the patient should be assessed. Okay. Then all articles should be arranged for oxygen supply, example oxygen cylinder, etc. Okay, we have to assess and check the before giving to administer. Before giving any doing any procedure, we have to assess the patient. Okay, in this case, we have to assess with the pulse oximetry or ABG or etc. Okay. So till now we have discussed about the oxygen administration and purposes, etc. Hope you understand. Thank you.